Hello, we are from DKM5A. The title of our mini project is Public Mental Health During Covid-19 Pandemic. This is the subject of Communicative English 3 and our lecturer is Madam Pravena Manukaran. Our group members are made up of 3 people which are Wan Kashifah Arifa, Nurfatin Izzati and me Hazirah Izzati.
Assalamualaikum and good morning. My name is Wan Kashifah Arifa Binti Mohammad Jannatul and my matrix number is 23 DKM 19F1003. Our research topic is mental health and the title is Public Mental Health During Covid-19 Pandemic in Malaysia Survey. Mental health is an integral and essential component of health. The Constitution of the World Health Organization states that health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Mental health is also a state of well-being which is an individual is aware of his or her abilities, can cope with the stresses of normal life, can work productively and is able to contribute to his or her community. It is fundamental to our collective and individual ability as human beings to think, be passionate, interact with others, earn a living and enjoy life. It encompasses our emotional, physical and social well-being. Mental health also affects the way we think, feel and act. It also helps determine how we deal with stress related to others and make the choices. The objective of this survey is to identify the mental health conditions that happen among Malaysians, to find the cause of mental health issues, and to provide the intervention strategies to combat the increasing rate of mental health problems in the ongoing COVID-19 pandemic. Gender. In Malaysia, women were more prone to mental health problems than men. A higher percentage of mental disorders was also found in younger adults and in adults who came from low-income families. Risk factors increase if a person has a blood relative such as parents or siblings who have a mental illness or a persistent chronic medical condition. Some people who have a traumatic life experience are also reported to be at high risk of developing mental illness. Mental disorders cannot be avoided or ignored by anyone who suffers from them. Those who involved should always seek professional help early. Through proper diagnosis and treatment, the majority of people who suffer from this mental disorder are able to overcome it and lead a normal life. Although mental illness doesn't discriminate, certain types of illness such as depression have been found to be more influential in one gender. For example, women are almost twice as likely than men to be diagnosed with depression. Coronavirus are a large family of viruses that cause illness from the common cold to more severe illness. This virus is a new strain that has never been identified in humans. This new virus was later named COVID-19 virus. The COVID-19 virus outbreak is the largest infectious disease outbreak to hit Malaysia. The ongoing COVID-19 pandemic so far has claimed the lives of more than 28,000 Malaysians. Many people lose their job during the pandemic and this will result in many problems occurring such as families losing their financial source, no food supply during lockdown and many more. There are students who have mental problems due to the excessive quantity of assignments. students who have financial problems to study online, and as well as students who are disturbed by their families at home. This is not only pose difficulties in the short term, but has significant implications for the long term well-being and development of children. In addition, there are many other difficulties that we can encounter during a pandemic. The study found that the rate of mental health problems experienced before the outbreak was lower than the rate of mental health problems after the outbreak of COVID-19. This is very worrying because if it is not curbed, more and more lives will die. Indirectly, this will have a big impact on the country.
And I'm Nurfatin Izzati Binti Mohammad. My metric number 23 DKM 19F1016. I'm from DKM 5A. So, I will explain. This is the sample of our survey question. First question, during pandemic, have you had any problems with your work or daily life due to your physical health? The rate of work problem due to physical health, the majority had not physical mental problem during the pandemic. Next question, question number 2, how will you rate your mental health? The rate of Malaysian mental health average with as many 31.4%. Next question, question number 3, have you had any problems with your work or daily life due to any emotional problems such as feeling depressed, sad, or anxiety during pandemic? Percent of work problem due to mental issue is yes. The majority is yes. The majority percent of work problem due to mental issue, yes. Next question. During a pandemic, how often does your mental health affect your relationship with family? Mental health affect your relationship with family. The result is not at all, with a many 44%. Next question. Question number 5. Is there a history of mental disorder in your family? Result history of mental disorder in your family, the majority is no. Next question. Question number 6. When did you last get your mental health examination done? Last get your mental health examination done, the result is, the majority is never. Next question. Have you used any mobile apps or features on existing apps of manage stress, anxiety, or depression as a result of the ongoing COVID-19 pandemic? The majority is no. No mobile apps or features on anxiety apps to manage stress, anxiety, or depression. Next question. Question number 8. Do you feel you are able to cope adequately with the stress related to the current situation? The majority is yes, with as many 85%. Next question. What did you do to recover your mental health? The majority go to a place that will help to calm your mind, 50%. And the last survey question with my group. Do you feel safe when sharing your stories or problem with others, friend, family, or counseling? The majority is yes.
As we can see, this is the first question for our survey. The data obtained showed that the three answers were chosen by 97 respondents. The answer of no got the highest place at 58.8% from 97 respondents compared to other answer options. The answer to yes was chosen by 29 respondents, and finally, the number of respondents who did not know about their physical condition was about 11.3%. The following is a pie chart for the second question in this survey. This question is to get information on the mental health of Malaysians during the pandemic. The rate for Malaysians who chose the answer excellence was 15.5% and 23.7% for answer somewhat good. 33% respondents chose average as to describe their mental health, and somewhat poor is about 12.4%. The poor answer are chosen by 4.1 of 97 respondents, and the last one is 11.3% respondents are not sure about their mental health during pandemic. This slide shows the rate of Malaysians having problems at work or anywhere due to any emotional problems such as feeling depressed, sad, anxiety, and many more during COVID-19 pandemic. The data that we have shows 49.5% for the yes answer and 41.2% of respondents chose no. Finally, there were 9.3% of 97 respondents who did not know about their mental state.
Has three objectives, so we have divided the objective into their respective part. So, my second objective to find the root cause of mental health problems. So, I would like to know about the impact of mental health on the relationship with family, disorder your family, and when was the last time you complete your mental health check. Where is my first question about the impact of mental health in same family relationship among pandemic, where we can all look at the survey to all who have done the survey that we share here. Many do not have problem but a little worry. There are also those who often have problems with their families. What we all know, this mental health problem is pretty difficult to climb. For my second question, that achieves is objective. We also went about the history of mental disorder in your family, where we can see more than 10% no mental health disorder in the family. And the last question, when was me last time you underwent a mental health checkup? This is also very important for us to know more about the last time we meet or underwent a checkup for each individual. Here we can see 73% in the range never made a checkup, so we don't have to worry about the condition of the individual. Thank you.
Hello, my name is Hazirah Izzati Binti Yahya. I am from DKM 5A, Manometric 23 DKM 19F1130. So I will continue with my presentation, which I will explain feature about some questions from the survey that our group have done. For the first graph, the question, have you used any mobile apps or features or existing apps to manage stress, anxiety or depression as a result of the ongoing COVID-19 pandemic? According to this bar graph chart, the number of respondents who said no was greater than the number of respondents who said yes. As we can see, not many Malaysians use applications to assist them when dealing with mental health issues. According to our survey result, 72.2% said no and 27.8% said yes. This means that 17 of our respondents did not use the app to assist them, while another 27 did. Based on this information, we can make an effort to reduce the rise in mental health problems in our country. This search is to create applications that can be downloaded via mobile phones. We can clearly see here that the vast majority of people in our country do not use applications that can assist them in dealing with mental health issues. This is due to a variety of factors that prevent them from using it. So we must develop applications that are extremely useful and beneficial to them in order to entice more Malaysians to use applications that can assist them in dealing with mental health issues. For the second graph, the question is, do you feel you are able to cope adequately with the stress related to the current situation? According to our data, the majority of our respondents were able to maintain their mental health during the pandemic. During the pandemic, as many as 85% of 82 people were able to control their emotions and cope well with problems and stress. Meanwhile, 15.5% of the 15 people lacked emotional control and were unable to care for their mental health. We can draw the conclusions from this data that there are still a significant number of Malaysians who suffer from mental health issues. As a result, we can assist Malaysians with mental health issues in dealing with them using this method. Furthermore, by completing the survey, we will not ignore or overlook those who need our help. Indirectly, we can help the majority of Malaysians because a few of them do not know how to ask for help in dealing with their problems. Besides that, some of them are hesitant to come forward and disclose the truth about their mental health issues. For the third graph, the question is, what did you do to recover your mental health? This question is for the respondents who said yes to the previous questions. This question inquires as to how they recover from their mental health issues. There are several approaches we can take to address our mental health issues. However, for our survey, we only include 4 options for restoring mental health, such as make an appointment with a counselor, participate in religious activities, visit a place that can calm the mind, and meditate. According to the data, 49.5% of the 48 people choose to visit a place that can help them relax. Following that, 41.2% of 40 people participate in religious activities. Furthermore, 5.2%, which means 5 people, choose meditation, and 3.1%, 3 people choose a counselor. As can be seen, a minority of respondents choose meditation and schedule an appointment with a counselor, while the majority of our respondents choose to participate in religious activities and visit a place that can help them relax. In my opinion, the best way for Malaysians suffering from serious mental health problems to recover is not to go on vacation or to calm their minds. They in turn should seek the assistance of trained counsellor. In addition, they require the support and attention of family members. This is due to the seriousness of mental health issues. Furthermore, one of the reasons an individual should see a counsellor is because of serious mental health problems that are difficult to solve in such a simple way as going on vacation or calming the mind. This is due to the fact that it involves how we think and how a person will react to a situation. For an individual to recover normally, consistent therapy, specific methods and various efforts must be made. For the fourth graph, the question is, do you feel safe when sharing your stories or problems with others such as friends, family or counselor? In response to this question from our survey, The majority of our respondents felt comfortable discussing their problems with family members, friends, and even counselors. According to our data, 64.9% or 63 people answer yes, while 35.1% or 34 people answer no. We can see here that the majority of Malaysians have no qualms about discussing their problems, particularly with counselling. This is a good thing because when a person needs a counsellor to help them with their mental health issues, they should feel completely comfortable discussing their concerns with the counsellor. Furthermore, an individual and the counsellor must communicate well so that the individual can tell and explain their problems clearly, and the counsellor can help and give views, advice, or ways to solve their problems. Counselling will also be able to help individuals with mental health problems more effectively if there is a good communication and relationship between counsellor and individual with mental health problems. Respondents who answer no are likely to have a reason that makes them feel uncomfortable discussing their problems with counsellor or even outgoing members or friends. According to our research, one of the factors that makes them feel uncomfortable about telling their problem is that they do not believe or are not confident about telling their problems. This is because they are likely to have encountered a situation in which they confided in someone they trusted, but that person revealed his secret to someone else. Aside from that, they believe that not everyone understands the situation or problems they are facing.
The conclusion, our study showed that mental health symptoms, especially depression and anxiety, have been overwhelmingly prevalent in the Malaysian population as the COVID-19 pandemic has progressed. Although the number of COVID-19 cases during the data collection period was relatively low, there was a continuous increase in the percentage of respondents with depressive, anxiety, and stress symptoms, implying a cumulative mental health burden. The increase in the rate of depression was most rapid, and the rate of depression was dramatically high as the COVID-19 pandemic moved into the 7th month in Malaysia. Poor health status was the strongest significant predictor for depressive and anxiety symptoms. By demographic, your people, particularly students, female, and people with poor financial condition, were more vulnerable to mental health symptoms. These findings emphasize the necessity of monitoring mental health disorder among the public during the COVID-19 pandemic and subsequently providing target intervention for people at elevated risk as identified in this study. Thank you.
The suggestion or recommendation that we can suggest after we make our research. According to our data survey, the huge majority of our respondents have never used an app to assist them in dealing with mental health issues. We can see from there that we can help them using such method or means. That is done through an app that can only be downloaded on a mobile phone. To be honest, going through a method or way like this is difficult for us. However, with the research and ideas from teammates or close family members, we must be able to keep this effort going. Through our research, we discovered that countries around the world have launched a number of applications to help their citizens who are suffering from mental health issues. Besides that, it has potential to reduce the rise in mental health problems in their country. Among the apps developed are those designed to assist their citizens in remaining safe when considering suicide. The apps also connect their citizens with helpful resources to contact when they are in desperate need of guidance. It also connects users with trained counselors from the National Suicide Prevention Hotline. There are various other very useful apps that can help in dealing with mental health issues. After doing some research, I believe that applications like this can really help a person who is dealing with mental health issues. If we do more research, we will examine the existing applications which have their own advantages and uses. Of course, we can help to create applications like this in Malaysia. In fact, we will further improve from the existing application to make it easier and help Malaysians to use it. This is one of the steps we can take to help reduce the rising number of cases of mental health problems among Malaysians, particularly during this pandemic. That's all from me. Thank you.